new study is revealing the true impacts of COVID-19 rules and restrictions across the United States. According to an investigation by the JAMA Health Forum, up to 447,000 lives could have been saved if every state had imposed rules similar to those in the 10 most restrictive states. The study also found that mask mandates and vaccine requirements were the most effective in preventing deaths when compared to states that didn't have those rules. CBS News medical contributor Dr. Celine Gounder joins me now. She is also the editor-at-large for public health at the Kaiser Families Foundation. So, Celine, there were major fights over COVID, and I have to confess that even thinking back on that time, it started to become a little bit fuzzy. So remind us about the rules in these 10 most restrictive states and what you took away from this study.
Well, I think we are going through this period of revisionist history where we're rewriting what actually happened and what worked or didn't. And I think what is so important about this study is its objective science as to what worked. So what we're seeing is in states that had vaccination mandates, that had mask requirements, there were lower rates of death from COVID than in states that in fact banned vaccine mandates and banned masking requirements. So these are measures that in fact worked. And this is important because we will have future epidemics and pandemics, and we need to know what we should actually be betting on and using to protect ourselves the next time.
Well, so if mask and vaccine mandates had such positive successes, and especially when you look at the number of lives that the study's authors predict could have been saved if that had been a federal requirement rather than a state-by-state requirement. I wonder, just now as we're seeing a resurgence of COVID, it's a totally different situation, obviously. But should more people be wearing masks? Should we have vaccine mandates?
Well, so first of all, the federal government cannot mandate that. That really is power that sits at the state level to make those kinds of public health decisions. But setting aside any kinds of mandates or requirements, should we be wearing a mask, especially if we are sick with COVID or we are high risk for complications from COVID? My advice as a physician, as a public health expert would be, yeah, if you're sick with COVID, you should be wearing a mask to protect other people. For example, if you're in close conditions, like on a bus or on an airplane. If you are somebody who's high risk for complications, you're immunocompromised, you're elderly, even if you've been vaccinated, there is benefit to masking to protect yourself.
And we know from wastewater studies, as well as just anecdotally, that we're all hearing more and more from people who are coming down with COVID right now, that there is a resurgence. But that's also prompted people to wonder again about where we are in terms of booster shots, in terms of rolling out new vaccines. What can you tell us?
So we are going to see boosters updated this fall. In general, what we can expect moving forward is because of your immunity to infection waning after, say, about 3 months, we can expect to see quarterly, twice a year, at least waves of COVID. So for people who are very high risk, so the elderly, especially if they're living in a nursing home, people who are immunocompromised, those groups in particular should get boosted and maybe even boosted twice a year. For the rest of us, I would plan on seeing boosters for COVID, just like you do the flu every fall and winter season. And, you know, if you want to reduce your risk of getting sick, even if it's just a nuisance infection, you know, that may keep you out of work or school, it's well worth getting vaccinated.
All right. Dr. Celine Gounder, thank you.